he spends 7-8 minutes writing a prescription.
Right.
Now, if the same amount of time is initially diverted towards adopting this technology, all these can be templatized, and that prescription writing can be completed in just 30 seconds to 1 minute. They feel that investing in training, investing in upgradation of skills is a cost factor.
If the doctors have a data, it can be a biggest growth engine for him. Today I welcome to our podcast a very special guest, Dr. TJ Pradeep Kumar, who is a director of Brookfield Hospitals and senior consultant at Medicover Hospitals, Bangalore. Welcome to doctors.
Good morning.
Thank you very much for joining our podcast. So I would like to discuss what was your visions behind Brookfield Hospitals,
Right.
or what was initial thought to start a Brookfield Hospitals?
Being a physician at heart, being a cardiodiabetologist by training, being a promoter of Brookfield Hospital by way of my entrepreneurship, what I felt was I need to bring in all the skills under one roof. As part of this, our journey began close to almost around 15 years ago with the visualization and the concept of Brookfield Hospital. The aim was to provide a kind of a one-stop solution for all the patients requiring quality care, affordable care, which is trustworthy. That's where the journey began almost 15 years ago. And just yesterday, we've completed 15 years of our existence.
Congratulations, doctor.
Thank
Great.
you so much.
It's a good achievement on 15th years anniversary.
Absolutely.
So, many doctors have visions or aim to start their own hospital after the clinic. So, what is your biggest fear when you had to start your clinic or your hospitals? What was your biggest fear?
So the fear that I had was the magnitude of the infrastructure that is typically visualized for setting up a hospital, the lack of team that you need to have to start a multi-speciality hospital, to ensure that we are able to would we be able to satisfy the needs and demands of a patient, being a kind of a boutique hospital? Would we be able to put in our processes in place, ensure that our staff are adequately trained? These were the challenges that we had when we started off the hospital.
So when we discuss many businesses or doctors say we require a motivations to heal and all, but beyond healing, as we know, to build a hospital, many things required. So I would like to know what was the 2 or 3 big your decisions which was shaped the futures of the Brookfield Hospitals, and yet you are continuing beyond 15 years.
One of the most important things is you need to have a strong clinical leadership. Apart from this, you need to have a well cohesive, like-minded team of professionals who align with your vision and mission statement. You need to have a dedicated team of professionals to ensure that they are able to execute all that you have actually put in as processes. If you have good leadership skills, if you have a like-minded team and a dedicated team, and you have adequate support for ensuring all these things are aligned with patients' success, patients' safety, patients' treatment being at the core and central of all this, I think we will be able to achieve what we want to achieve.
Great, doctors. So if I put in this way, doctors, that beyond clinicals, it's a mandatory or a primary. So beyond clinicals, what are the if doctors have a 30 to 50 bedded hospital or 100 bedded hospital, what are the main non-clinical pillars which dictate a hospital success, or which define that hospital is going to beyond a certain level, it's going to grow, or just will be a steady going to struggles?
I think that's a great question, Ramesh. What hospitals, the mid-sized hospitals, kind of lack is they're constantly involved in a kind of a firefighting mindset to deal with day-to-day problems. That is because of a kind of a lack of processes in place, lack of training in place, lack of setting the expectations amongst the people who are workforce of the organization. And if you are able to ingrain that core vision and mission statement, just not in your brochures, in your websites, if that is something that you can ensure that sinks into each and every employee of the hospital, then I think majority of the job that needs to be done will be done.
Good. So, doctor, just you mentioned that training. Okay. So, I find fascinating. Maximums doctors, when I go and I'll meet them, as I across India, I have met more than 5,000 doctors, and so they see that training is a mandatory or a necessary, even though they won't take decisions on that. So they won't allow themselves to put infrastructures in technology or training. What, like, it's a mindset or it's a personality, or what stop them in this?
As you rightly pointed out, it's more to do with the mindset. They feel that investing in training, investing in upgradation of skills is a cost factor. They do not treat it like an investment. People who have actually treated this as an investment have naturally found 4x, 5x, 10x returns on this investment of upgrading the skill sets, upgrading the knowledge, and making sure that they are adequately being trained towards patient care. It's essentially talking about customer experience. When we are talking about delivering customer experience, it is infinity. Their expectations can keep increasing day by day. They may experience your services today. They may experience a multi-speciality, a super specialty, or a branded hospital services tomorrow. They come back to you and then they expect something similar to be needed in your own hospital. But given the kind of constraints that a 50-bedded hospital or a 30-bedded hospital has in terms of limited infrastructure, limited resources, it could be financial, it could be manpower. Here, you need to ensure that they're adequately trained to do multitasking. And that would probably help hospitals to ensure that the investment they make on training will yield multiple X returns in the due course of time. And they should not treat it as a cost, they should treat it as an investment.
So I'll put in this way, like doctors or any other businesses also, many times what will happen, they hire someone. Like if doctor is hiring the receptions, doctor assume that she should know or he should know that work. Okay, they are not putting much effort to train what kind of work they want to deliver from them. It is a hospital responsibility to train their staff so they can deliver a quality services or a quality result or quality discussions to their patients among the staff. It's a kind of responsibility of the hospitals.
Absolutely. It is extremely important, irrespective of any employee for any role. They may have experience, they may not have experience. But what is most important is that you need to set the expectations for your employees. Okay. You need to have a processed, protocolized, SOP-based onboarding process. You need to have a process which is going to make their early days in the organization more cultured, more systematic, more professional, so they enjoy working in these ambiences, and also they understand that this is my scope of work, these are my deliverables, these are my KRAs, these are my KPIs, this is what I would be evaluated on, and there is a growth story beyond this on what I'm doing currently. And when this kind of a structure is made available to them on the very first day or the first few days of their joining the organization, the employees feel that they are in the right place.
Great. So thank you. It was an amazing insight. So I would like to know that nowadays I see one big things like individual practices are declining. Individual doctor who's practicing, they are saying, okay, my patient is patient number count is reducing. Even though mid-size or small-size hospitals are struggling. Why do you think like this? And even though doctors are less in India, as numbers say.
I would like to take it in a different way. It is not that the patients are losing trust amongst doctors. It is patients who have got used to convenience, who have got used to productivity, who have got used to everything available under one roof when they walk in.
Okay.
So, with the advent of insurance playing a major role in the spending capacity of an individual, the patient expects that when I walk into a specific doctor's chamber or a hospital or a nursing home, all my requirements related to my health needs to be taken care of, which means they need to have the necessary infrastructure, the necessary skill sets, the necessary specialities, and all the investigative tools that are there, which is impossible for us to achieve in smaller hospitals, doctor owned hospitals, which specifically would cater to their specialty and their department. And that's where there is some amount of diversion of patients from doctor run smaller hospitals to multi-speciality hospitals, where they feel for the value for money is much higher when they go to multi-speciality hospitals.
So I'll put one more, like many doctors are not happy with increasing patient expectations. How do you take this? Like they are saying it's a patient expectations is increased, nowadays patient is changed. It is a like, no, how should doctor take in a better way or good way this? They are not expecting or accepting themselves that the patient is patient expectation is increased.
Right. So this is also a newer challenge that we're talking about when we talk about the Gen Z, when we talk about the millennials, when we talk about these set of individuals. They are obviously well informed, they are tech savvy, they have got knowledge at their fingertips. They come to you with certain assumptions based on whatever they have heard, whatever they have seen, and those false expectations that they have is that I feel I have this diagnosis, I feel I should get this, and when the doctor mentions to him or her that that is probably not the right diagnosis, that is probably not the right kind of a mode of treatment, there is a kind of a mismatch between expectations and the delivery. The doctors need to also change in their mindset that obviously now you're going to get more well informed individuals and you should be adequately equipped and updated so that you do not fall short in the expectations
the
of the
expectations
patients.
gap is like that is a bigger things compared to whatever happening. So my next to this only, like small hospitals or a like no single owned hospitals, what is the competitions compared to multi specialties chain hospital nowadays in India? It's a fast, like no, it's a, we cannot imagine the way multinational hospital or a chain of hospital is growing. So how do like no balance with them or no beat them or be in a competitions?
So the current context is always should be focused on collaboration rather than competition. You need to understand and accept what is it that you are good at. You should also understand what is it that you lack, and also bridge that gap by pigging along with those so-called multi-speciality hospitals. Now, a typical classical example is what I have done with my own career, with my own association. You are aware that I've been running Brookfield Hospital over the past 15 years. Now, in a Brookfield Hospital, which is a 60-bed multi-speciality hospital, I may not be able to provide the entire range of services that a person with complex disorders may have. Now, to compensate for that, what is it that I have done? I have joined hands with Medicover Multi-Speciality Hospital, which is a UK-based super speciality hospital, a 450-bedded multi-speciality hospital closer to my facility.
Okay.
And what we have done is I come here as a senior consultant to consult my patients here. When I go back to my hospital, I expect that all patients who require any of those super specialty services which are under which require multi-speciality support with various diagnostic facilities and other specialities, Medicover Hospital stands by me and we are able to refer the patients here and take care of them in totality. And I don't lose out on those patients,
Okay.
and I still
So
continue to gain those patients.
even though it will increase the trust also when you refer to them and they welcome that they know before coming to hospital, so they also get one kind of trust on you, right?
Absolutely. So this is the way forward. Now, whatever that we do, you understand that there are certain limitations, but you need to try and find solutions for this. And this is one way in which I have tried to coexist with the big brands that are available that you mentioned about, and we can always continue to be relevant to our patients to make sure that patient remains in the center of any decision that you take, and all that you're doing is to ensure that all your services, all your actions are diverted to making patients' health of paramount importance.
Why nowadays doctor is hesitating or investing on training and technologies? Nowadays they are not allowing themselves to accept that technology is a mandatory for them to survive or make stables or grow, even though it is they know, but they are not investing on they are not ready to accept.
So part of it, I would say,
Majorly,
Ramesh,
I say, not all the doctors.
part of
I
it.
appreciate the way you are focusing on AI and all.
So, as I told, part of it is as a result of, you could call it ignorance. Part of it could be because they have reached a threshold for their practice. They have their hands full. There are people, doctors who see 80, 100 patients a day. They do not have any time to spend to upgrade on technology. Third is they may be technically challenged individuals. Not all of them are tech savvy. So we need to consider all these aspects. And if there are success stories that are shared with these doctors on how implementation of technology helps doctors in their practices, then they will be forced to change and adopt technology. Simple examples are doctors who use electronic medical records.
Right.
All those doctors who use electronic medical records, initially they may find it difficult. That is basically because of our ingrained training on talking to patients, writing down our prescriptions. But here, since it involves typing, since it involves less of eye contact, the doctors are averse to adopting this technology. But imagine a doctor who spends 10-15 minutes with a patient during a conversation. He spends 7-8 minutes writing a prescription.
Right.
Now, if the same amount of time is initially diverted towards adopting this technology, all these can be templatized, and that prescription writing can be completed in just 30 seconds to 1 minute. Imagine the amount of time that is saved by adopting this electronic medical records.
So as you mentioned, doctor, that 100 daily doctor who have 100 OPD. When I go and I discuss that, doctors, your maximums work, whatever you are discussing and talking, AI can do or technologies can do, they are not ready to put initial time. So why do you think they are not ready right now to put initial time? And even though I say, if you are not putting right now time and effort, so in a futures, like other doctor who's using, they also they can take your patients, because your patient get used to experience of that kind of experience. What do you say on that?
So we need to look at it in 3 different angles, Ramesh. One is fear of technology. Second was time constraints that we talked about. Third is adaptation. Now, what is this fear? They feel that this technology is not for me. It is something that is beyond my understanding. I think that a person who's done his MBBS and a person who's done his MD, the amount of vigorous training that they have undergone, learning these smaller nuances related to adopting minor technology is not going to be any great. How long will it take for us to be averse to any of those technologies? I'm giving you a simple example. Something like a voice to text scribe, which is
Right.
available.
Mhm.
These are AI enabled tools. Now, these AI enabled tools, if you are just able to adopt this, there is something called as an Eka Care, which is
Right.
a company which has got this. So you just need to enable this into your EMR, and then the entire conversation that you have between the patient and the doctor gets automatically recorded in its specific subdivisions of chief complaints, history of present illness, past history, provisional diagnosis, investigations, treatment. It automatically gets recorded.
Okay.
Now, what is it that you are doing? You're not doing anything at all. You're just continuing with your normal flow of conversations that you have.
Right.
Second thing, if this conversation that you're having is going to automatically go ahead and digitize a prescription that needs to be generated for a patient.
So you discuss that discussions have converted into text. Text is converted into prescriptions.
Prescriptions.
Yeah.
And imagine the power of this when you have a digitized format of your prescriptions and you have an AI tool to analyze these. Now, all these things is enormous amount of use for us in the days ahead. A person who's treating 100 patients, a doctor who's seeing 100 patients per day, imagine he has got close to almost around 30,000 patients at the end of a month.
Right.
He has got a 3 lakh patients at the end of a year, and by the end of 10 years the amount of data that he's got is enormous.
Right.
And we are losing out on all those data that is not available for us for clinical research purposes. And if we were able to utilize all these things, it is going to be enormous amount of use. The government has taken huge steps.
Okay.
With the digital mission in the health, the ABDM that is happening, each ABBA ID that a
ABBA
person
ID
has
is
to
great.
have. Now, if every person has got an ABBA ID, if every hospital or a treating unit has got an ABBA ID related to their medical service provider, now this can, a patient doesn't have to carry his records, remember his records from one city to the other city or from one country to the other country. The doctor will have access to these informations based, which is completely safeguarded through the optimized platforms, and this can be collaborated across all the doctors, and our research outputs will be improved tremendously. All this time we've been talking about guidelines related to US FDA guidelines, we talk about European guidelines. Our patients are different. Our infrastructure is different. Our needs are different. We need to have our own localized guidelines for our patients. And where do we get that? It is only when you connect this data and we are able to channelize and get this.
I'll put a simple things on that you mentioned about the data. Like data is not just for, as you mentioned rightly, it can be helpful for research and development, as well as if the doctors have a data, it can be a biggest growth engine for him. How I'll put in a simple example. One of my patient who went to one of the nutritions, one of the my family person, so went to nutritions. What they did, they did not collected the data or their contact numbers. Okay, and patients came to house and he followed a diet. Second consultations also he went after the 10 days and he came with the prescriptions he did not followed, and after that doctor also he did not called or message or follow up with him, and she lose the patient, and then the family member have went to again to other doctors. Okay, exactly. So data can help to power their growth engine also. That can be a biggest mystery or a biggest power nowadays to grow their hospital or clinic, right?
So it is now we call data and AI as the gold rush of the century currently right now. What internet was a few years ago, now it is AI, which is probably the gold rush. And as you rightly pointed out, doctors have to get trained in AI, get trained in technology. If they don't do that, obviously they are going to be replaced by doctors who are already using AI and who are already using technology. If you want to stay relevant, if you want to be a force to reckon with and be relevant in your clinical practice, my strong suggestion through this podcast would be for every doctor to adopt AI and technology in whatever way and fashion. Start small with small steps, and then as you get comfortable, start looking at bigger things, and then sky is the limit. This is what would be my important
And
message.
I'll put, as you rightly said, the AI importance, and we'll come to again to AI also. Like, it is not like that doctors who will use the AI will be in a one bucket, and doctor who won't use AI will be in a one bucket. Like, who will use the AI, they'll like get advantages over non-use who's not using the AI, right?
The reason for that is because it will bring in the vast difference between the haves and the have-nots. That can be bridged by adopting technology and adopting AI. It is the same technology piece that needs to be adopted for a small clinic, for 100 bedded, for a 500 bedded. And if that same piece is made available, you are almost on par with all the super specialty hospitals that you keep talking about. You have the data which is integrated, you have the full download of your patient's history, historical ailments, treatment. You can have access to those data that is being generated at other hospitals. All this makes a one person operated clinic become more efficient, more scalable. Imagine sitting in my OPD, I would be able to consult a patient who is sitting 1,000 miles away, either in the US or in the UK or in a Middle East country or in the South African countries where there is a need for more of these doctors. And imagine all these things generates revenue multifold. That's the power of adopting technology, adopting simple steps like telemedicine. And though you are local, you can operate globally, and that's something that everyone should use.
How importance of AI for the doctors? Doctors say, if I won't use also, I can survive similarly in futures, like in a 20 year, 30 years, like it is going to be completely changed the way doctor doing practice right now. Beyond 2036?
I don't think we have the insights to think that far. What I can assure you and tell you right now is the knowledge that is being gained by AI is getting doubled every 2 months.
Oh, so it's
getting doubled every 2 months.
So
imagine at the end of 1 year, at the end of 2 years, at the end of 5 years, we really don't know what can be the capability of AI that can impact our clinical practice.
So, doctor, I just want to know from your side that if one is a small clinic or a medium-sized hospital, if they want to implement or start the use of AI, from where or which department they can start?
Okay, so let's talk sector-wise. If it is to be sector-wise, let's talk about front office. Mm-hmm. The front office by itself can completely get automated in such a way that you have these chatbots which are available, you have these voice robots which are available. Now, this is a technology that even a small clinic can probably automate right from the time that there is a call. The patient calls up asking for an appointment, the time, the specialist, is this particular facility available, what is the cost of this procedure. All the standard questions that are there can all be automated and answered by those robots that are there. So that's the simplest form of a tool that everyone can probably use it. The second level at which they can use is, they can use this as a substitute for a receptionist that I talked about. The second level is, it can be used as a marketing tool. You can develop AI agents and make sure that you're able to kind of create this particular project and say that I want to run a marketing campaign to promote diabetes in my hospital for the next 1 month, and I need contents and flyers and channels across all social media channels, including my website and including my social media profiles. It is beautifully elaborates and gives you all these things. So these are some kind of a simple tools that I'm talking to you about. Simpler, smaller hospitals. Now let's go to bigger hospitals. Now bigger hospitals can utilize this in a much bigger way. Now, for example, in major hospitals where you have a huge patient overload, where there are a lot of images that are generated. Which are the departments that generate a lot of images? Radiology is a department that generates a lot of images. Dermatology is another department. Ophthalmology is another department. Pathology is another department. Now, all these departments rely a lot on images and interpretations.
Okay.
Now, when the machine is submitted to all these images over a period of time, the learning language modules that are used on these things can be fine-tuned to such an extent where it can actually give reports as intelligent as an experienced radiologist, as an experienced ophthalmologist, as an experienced pathologist. It can give that kind of a reports which are so accurate, but it needs vetting by a specialist to make sure that all these learning modules which are
To
interpreted
verify and process
Exactly.
or to approve, right?
Exactly.
So according to you, which department is going to use we can use a maximums, or going to be have a one kind of replaced by the AI?
I wouldn't want to call it replaced as of now, but we don't know what is the future. The departments which I talked to you about, one is radiology, which I told you, it's strong in terms of using technology to a very large extent, right? Now, let's move to a little higher level of adopting AI, robots, and other stuff. We all are aware of how a doctor sitting in Bangalore here can operate a patient who is in Nigeria
Right.
through the robots, through the 5Gs that are available. Now, the technology is evolving so much right now. Now, there are a whole lot of Internet of Things that are available. There are a whole lot of monitors that are available. The shirt that you wear, the watch that you wear, the sleeping pattern that you have, what you eat, how you exercise. We are able to create a digital twin of an individual.
Okay.
So a physical person is one. We are able to create a digital twin on
One
a
kind
particular
of clone.
person. Clone, and you're able to actually do interventions on these people on this digital twin and say what is it that will happen if I do this intervention in terms of diet, in terms of exercise, in terms of medications. How will this respond? So even without trying it on the actual patient, you're able to use it on this, and then finding it, you're able to fine tune and then give this finalized version to the patient. That's how advanced this particular technology is, which is actually available currently.
I'm now curious to ask, do you think like in a research and it's going to be used more than like animals and other things going to reduce?
Exactly. That's the advantage of technology. This technology will no longer be talking about monkeys, rabbits, rats, mice, what we were using previously.
Yeah.
That's how what we were able to see how the COVID vaccine was developed in just 1 to 2 years from
Right.
the time of concept to the time of actually getting delivered. So it fast tracked this entire process, which usually takes around a decade.
Okay.
We were able to do it in 1 to 2 years time, and that's the advent of these technologies that we have.
Predictions, you say predictions is a much faster, and result also much faster compared to what we was doing as previously as a human, right?
Absolutely, absolutely, because we all know that the effect of a particular medicine on a rat or a monkey or a mice may be entirely different from what it actually is on a human being. So here we are able to actually use it on human being by these technologies artificially,
Right.
and then get these results.
Wow, amazing. I was not knowing this. So thank you for putting to my audience and to other doctors also. And now I want to come like, how do you bust the myth of doctor who want to use the technology or AI? They say it's expensive. They don't want to use because of just for, they say it's a kind of expensive or maybe high volumes, or I have to pay much. And even though it's I don't think so every things is over expensive.
Let's have some realistic practical scenarios that are available right now. Now, how much would be the cost of a receptionist that needs to be hired for in a hospital?
If I'll go to tier 2 city, there is a different, and let's take a metro. We are sitting in a Bangalore, so take Bangalore. It won't come minimum 25,000, 30,000. That's a basics.
Basic.
I'm saying that's not a well trained.
So, which amounts to 3.5 lakhs
Yeah.
per year, right?
Right.
And do you have an assurance that this particular person who's going to be performing to the best of the task?
No, no.
Do you have the assurance that this person is going to be performing 24/7 for you?
Never.
Do you have the assurance that this person is not going to take leaves every now and then, submitted to stress, so having family problems and issues? Do you have that assurance?
No, nothing.
Put in an AI. Have this person, this entire 3 staff that you require for 24 hours can be done by an AI agent, and this AI agent will do all this seamlessly.
How can my audience can get this task or this tool if they want? There is any company who's providing this service?
There are multiple. There are multiple companies which are actually doing all these things, which is all available currently right now at the tip of our fingers. We just only have to make sure that we utilize these things. I mentioned to you about Eka Care as one particular thing. So this automates this entire process of scheduling appointments, answering those questions, taking through the entire journey of doctor-patient consultation, recording them, creating a digitized prescription, sending them reminders, asking them to give them a reminder to come back. Imagine it will also send you a reminder to tie up with the medical stores to go, the medicines will be delivered to their doorstep. It will also tie up with phlebotomists and laboratory and diagnostics. The message will go to them. They will come to your house, take blood samples. Everything is done seamlessly.
Oh, great. So we also building one, as I discussed with you, one platform for doctors where they don't have to train their staff physically. Our platform will take care to train them. We have to just say what purpose you are hiring. I do agree, some people required the training also, and doctor don't have a time and infrastructure to train each and everyone. So we are building a platform or a tool. Doctors have to put his role and responsibility, deliverables, training, what competency to develop. Everything will develop to doctors and will give to him. What will be benefit? Not only he'll deliver the excellent result, even though doctors can link this to their performance also, appraisals also.
Yes.
Everywhere he can link. Okay.
True.
Nowadays doctors are giving appraisals by gut field only.
Correct. Whereas here you will have a complete detailed description of each and area of deliverables of a person, and you can incentivize them accordingly based on those specific areas where they have delivered, and it is foolproof. Here the employee may come and say, my boss is having a bias, he's having favoritism, he has some favorites, and only they get these incentives, the other people do not get these incentives. Here it is all in black and white. You show this to them, you say that this is what your performance is, this is what your colleague has performed, this is why you're getting this is why they are getting this. So there are no hard feelings, it is completely transparent, and everyone, it's a win-win situation.
So by this we come to end of this. We have a 2 rapid fire things for you. So whenever I go and I'll discuss or I have a conversation with doctors, I say doctors, you please build your brand, don't rely on your personal name. Say, okay, Dr. Pradeep, I am Dr. Pradeep Clinic. You should build a X hospital or X clinic name, so you can be replaced over the periods. Doctors are not accepting this. They say no, I have to be there, then again to them, how long you will be there? Okay, so how do you these kind of doctors, what is your message to them?
Right.
Then how corporate is building?
Correct. So my answer to that question was that all of us should shed that kind of a mindset that you are going to be eternally present in this particular place. You have a personal life, you have a personal likes, dislikes, you have your personal hobbies, you have your personal health to take care of. Everything is not revolved around just your patients and your hospital or healthcare. You have to be, to prevent burnout, you have to indulge in all these other aspects that are there, for which you need to create a system where you are not irreplaceable. You have to create a system, put in a process in place where the process takes over, irrespective whether it is person A, person B, or person C. The system is built, it is robust, and it is an SOP based, process oriented. And that's where this automation comes into play. That's where technology comes into play. And that's where you will be able to have a holiday without worrying about your hospital or your patients.
Without a phone on the holiday.
Exactly.
So really, I'll thank you, doctor, for your valuable time. Making this podcast, my intention was who's doctor doing good work in their field or using AI or adapting to learning and doing new things. So whenever I know doctors learn many things in conferences, CMEs, and many things. They have to undergo CMEs every years, every month, like sometime to get a credit numbers to renewal their license. But these kind of non-clinically, there was not a channels or a platform in India. So I thought, let me build this, because I was a person of a marketing and management, and I'm trained in Bangalore from one of the experts of the Asia's biggest coach. So I thought, okay, put me a platform where I can get experts and we can discuss on the non-clinical part or topics which doctors want to know or want to learn, but there is no platform.
Amazing. You've been doing a very great job, Mr. Ramesh, and the new book that you had launched, The Medical Marvels, is definitely going to add value to all the medical professionals and doctors in particular. I wish your endeavor a great success, and we are here to partner with you and make sure that you reach greater success in whatever.
Sure. Thank you very much, doctors. And it was a great discussions. And once again, thank you from my bottom.
My pleasure.
Thank you, everyone, for joining this podcast. And I'm sure this is going to help many doctors. So we both like you to forward other doctors or a doctors community or group. So maximum number of doctors can be served. Whatever this platform is creating for. Thank you.
Thank you.
Thank you, doctors.
Hope it was all fine.
No, it was